Two children can both be 10 years old, but should they receive the same orthodontic treatment? Absolutely not. Here's why growth assessment is one of the most important topic in pediatric dentistry and orthodontics. Let's do a quick revision. What is growth assessment? Systemic evaluation of child's growth and development to identify normal variations or deviations that may affect dental and orthodontic treatment, which helps in diagnosis, treatment timing, growth modification, and prognosis. And why we need to assess it? So it helps in identifying growth potential, determines the best time to intervention, prevent future complication, guides growth modifications and treatment planning, improves stability and long-term results. But growth isn't measured by age alone. Why don't we rely on the birthday age? Because chronological age or the birthday age doesn't always match biological maturity. Two children born on the same day may have a completely different skeletal and dental development due to genetics, nutrition, hormones, and environment. So we assess multiple growth parameters, and that's why Krogman gave four types of age. First is chronological age, which is actual age of the individual from date of birth. Biological age, maturity level of tissues and organs based on the growth and development. Dental age, age estimation based on the tooth development and eruption. And physiological age, mental and emotional maturity level. Now let's look at the major growth assessment parameters. First is the somatic growth, which evaluates height, weight, and body build, and Sheldon classified these body types into ectomorph, mesomorph, and endomorph, which may influence growth trend. Then skeletal growth. Skeletal growth assesses skeletal maturity using hand wrist radiograph and cervical vertebra maturation. Then dental development. Dental development evaluates eruption sequence, classification stages, and dental age using different methods. Then biological maturity include growth spurts and secondary sexual characteristics. Then facial growth pattern examines facial proportion, symmetry, and profile. And functional assessment evaluates breathing, swallowing, texture, tongue posture, mastication, and oral habits. To know everything in detail, visit Tiny Teeth Talk long videos, and I already mentioned it as recommend video in this short. Remember this simple sequence. Birthday age tells you how old the child is, but growth assessment tells you when to treat. That's why growth assessment is the key to successful interceptive orthodontics and pediatric dental treatment. Follow Tiny Teeth Talks for more BDS and MDS exam oriented concepts made simple and pediatric dentistry made simple. Thing.